Hi students, this is Dr. Ways and welcome to your lecture on the back muscles. So some of these muscles that we're going over you will have seen before because we covered them in the shoulder area, but we're going to review them again here on the back and then go a little bit deeper to more specific back muscles. So starting with the trapezius here as a superficial back muscle, remember the trapezius goes all the way up here to the occipital bone, across to the shoulder, then down posteriorly to the vertebral column, and runs all along the vertebral column as its origin point for all of the thoracic vertebrae as well as the ligamentum nuchae associated with cervical vertebrae. And its action then is going to depend on which part of the trapezius is going to pull, be activated. So if we are pulling on this region here, we're going to have upward rotation of the scapula because here is the spine of the scapula where it's attached to. So upward rotation of the scapula, elevation of the scapula, so that's also going to be up here as well as through here, and then depression of the scapula when you are activating these fibers down here. The trapezius is innervated by the cranial nerve 11, also known as the accessory nerve or spinal accessory nerve, as well as ventral rami of C3 and C4. The Latissimus Dorsi, just inferior to the trapezius and anterior to it. You can see it's kind of tucked behind the trapezius right here. So its origin is going to be over here on the spinous processes of the last few thoracic vertebrae, as well as down through the lumbar and sacral vertebrae. And then it's going to go out to the humerus and on the anterior side. So its action then is going to be to adduct the humerus, so it's going to pull our arm back towards the midline of the body. Extension of the arm at the shoulder joint, because it's coming from behind and attached to the humerus, it's going to pull backwards, so it's going to extend our arm, entire arm, not just our forearm, as well as medial rotation. So since it's attached to the anterior portion of the arm, it's going to pull in this direction, causing medial rotation of the arm at the shoulder joint. And its innervation, the thoracodorsal nerve. Take the trapezius off and take the Latissimus dorsi off, and underneath we have three other sets of muscles. We have the Levator Scapulae up here, and that would be specifically underneath the trapezius, Levator Scapulae. So notice that that is attached to cervical vertebrae 1 through 4 specifically, and of course if it's Levator Scapulae, it's going to be attached to the scapula medial border. And when you contract this muscle, it's going to elevate the scapula upward. Innervation, ventral rami of C3 and C4, just like we saw with the trapezius. And then we have our rhomboids. We have the rhomboid minor, which is a smaller muscle that's located superiorly, and a rhomboid major, which is a larger muscle located inferiorly. They are called such because they have a rhomboid shape, and if you notice, they're attached to cervical and thoracic vertebra, spinous process of the vertebra, as well as to the medial border of the scapula. So when they contract, they're going to pull the scapula in this direction in what we refer to as a deduction of the scapula. So a deduction of the scapula. And both of them are supplied by the dorsal scapular nerve. So these pictures are just showing you the dorsal scapular nerve right here. That's going to be going to the rhomboid muscles, and cranial nerve 11, or the accessory nerve, that's coming down and going to the trapezius here. And if you remember, the thoracodorsal nerve, which innervates the Latissimus dorsi, is coming from the posterior cord right here and going down to the Latissimus dorsi. The deep muscles of the back are held in place by a layer of fascia called the thoracolumbar fascia. And we have three different layers to that. We have an anterior layer that is facing the abdominal cavity, or is on the posterior border of the abdominal wall, right anterior to the quadratus lumborum muscle. The middle layer right here is between the quadratus lumborum and the Latissimus Dorsi and Erector Spinae muscles, and then the posterior layer would go behind or posterior to the Erector Spinae muscles and allow them to be within a compartment by themselves. Now also notice that all three layers of this thoracolumbar fascia are connected to each other. All right, so it's one continuous membrane, if you will, of fascia, but separated into different layers depending on where it's located. So the first of our deep back muscles are going to be our Erector Spinae group, and our Erector Spinae group is going to be running along the same length as our spine or our vertebral column. And so they are a group of muscles, so there's going to be three of them that we need to know, and we're going to go from lateral to medial. We have the iliocostalis right here, the longissimus, which is this muscle right here, and notice the fibers going in a lateral direction here, and the spinalis, which is this set of muscles right here that are directly attached to the spinous processes of the vertebrae. And you don't see any origin or insertion information here because it's if you notice there, looking at the picture, there's a lot of origins and a lot of insertions, so we're going to bypass all of that. But the innervation is by the segmental dorsal rami. So what you're going to see is that each muscle is divided into groups, and those groups are innervated by the muscles in the same location, or I'm sorry, the nerves in the same location that the muscles are located. So if the muscle is located by T4, then it's the T4 segmental dorsal ramus that's going to supply the nerve to that particular part of the muscle, and that's going to be the same all the way up and down. And this isn't, these muscles, their job is to hold the vertebral column erect by extending the vertebrae. So what they're basically doing is helping you stand upright. And so to remember them, and the reason why I have them in red here, from lateral to medial, the iliocostalis, the longissimus, and the spinalis, I've seen some people say I like spaghetti to remember the order of these from lateral to medial. I like whatever S word you want to add in there. Personally, I love Star Wars, works for me, so just a little trick mnemonic device you can use to help remember these. All right, continuing with the deep back muscles, right here are the muscles that we've already covered. So now we're going to go into our, and those were the Erector Spinae group. Now we're going into the Splenius group, consisting of the Splenius Cervicus, which is going to go here to the cervical vertebrae of the neck, and the Splenius Capitis, which is going to go from here to the skull, to the back of the skull, the occipital region. And they are innervated again by segmental dorsal rami, just like we saw with the Erector Spinae muscles. So their job is to extend the head, because notice if it's attached to the back of the head and you pull this way, you're going to extend the head backwards, so tilt your head back. Or unilaterally rotate head to the same side. So what that means is that if you contract, let me do this in green, if you contract this muscle, your head is going to turn this way, and if you contract this muscle, your head is going to turn this way. All right, going even deeper, we have our transversospinal group. So 3 regions, Note that they all rotate opposite. So what that means is that when you contract on the right side, you're going to turn left. And when you contract on the left side, you're going to turn right. So we have the semispinalis, which is divided into three subregions rather. The semispinalis capitis right here, the semispinalis cervicus right here, and the semispinalis thoracicus. Notice that they are called, name those according to where they are located on the vertebral column. We have the multifidus, which are these muscles right here. And notice that, just to give you a clue to how these work, they are attached here, span 2 to 4 vertebrae upward, and when they pull, they're going to pull the vertebrae in this direction, making your body turn in this direction. So that's what we mean by rotating opposite. And it's only going to be a slight turn, so it's not something that's profound, but that's what we mean by rotating opposite. And then we have our rotatorys, and our rotatorys here are named according to where they're located, but they're going to be all these muscles right here. And notice that they span 1 to 2 vertebrae as opposed to 2 to 4 from the multifidus and the 4 to 6 from the semispinalis. All are innervated again by segmental dorsal rami. Then at the head we have some deep back muscles. These are going to be more associated with head movements than specifically just the back. And all of them are in gray here. The rectus capitis posterior minor here. The obliquus capitis superior here. The rectus capitis posterior major here. And the obliquus capitis inferior here. All right, so if you look at them, all of them are attached to the head, so they're going to be not only involved in extending the head, so tilting your head backwards, but also rotating in the same direction.